Okay, so I'm going to start by checking the physician's orders for the type of irrigation used today. I'm going to start by assessing the patient's pain, and can you tell me your pain today? And if necessary, administering pain medication 30 minutes beforehand. I'm going to start by warming the irrigation solution to about body temperature, and so I'm going to identify the patient using their name and date of birth. What's your name and date of birth? And then comparing that to their wristband. And then I'm going to explain to the patient that we're going to be doing a wet to dry dressing change today. And I'm going to raise the bed to a working height. Okay, and then I'm going to provide privacy and then perform hand hygiene. And then, so now I'm going to assist the patient to a comfortable position and just exposing the wound and assisting them so that the irrigation can flow freely. And then just exposing the wound like that. And then I'm going to get my waterproof pad, and then I'm going to position it to catch any runoff and protect the bedding. And then I'm going to grab my emesis basin and then put it right under them. Then my trash bag at the end of the bed. And then I'm going to perform hand hygiene again, and then put on clean gloves. Okay, I'm going to remove the Montgomery straps, and I'm going to take off the dressings and note that there's no odor or drainage. So I'm going to note that they used a ABD pad. There's no odor or drainage on the 4x4 gauze, and another 4x4 gauze. There's no drainage or odor. I'm going to inspect the wound and notice that there's granulin tissue, there's muscle and bone showing with definite tunneling and undermining all the way around. So I'm going to take my measurements with a tape measure and a Q-tip. So I'm going to start off by measuring the length, which is about 5.5 centimeters by 5 centimeters. And then I'm going to measure the deepest point of the thing, which is about right here. I'm gonna measure that. It's about 1 centimeter. And then the undermining is about also 1 centimeter all the way around. And then there's tunneling at the 2 o'clock position, which is about 2 centimeters. And then there's more tunneling, another one, the 9 o'clock position, at about, again, 2 centimeters. So I'm going to dispose this. I'm going to take off my gloves, perform hand hygiene. I'm going to document my findings, and then I'm going to perform hand hygiene again. And then I'm going to set up my sterile field. I'm going to start by opening this. Making sure I keep that 1-inch border. Okay, and then I have my 2 Q-tips in there and my syringe, and I'm going to add my ABD pad. Like this. Making sure that it did not land on that 1-inch border. I'm going to take my solution, I'm going to put my hand over the cover, and I'm going to pour it in. And if it was already opened, I would lift it into the trash can. Okay, and now I'm going to put on my gloves. Making sure I don't touch anything on the 1-inch border again. Going to grab this. Okay, so now that I have my sterile gloves on, I'm going to organize my sterile field, setting these to the side. Okay, and now I'm going to start by filling up my 35 milliliter syringe, and then I'm going to go over to my patient, making sure I don't turn my back, and I'm going to irrigate the solution about 1 inch away, and then going back and forth motion, superior to inferior. And then I'm going to do that until the solution runs clear. Okay, the solution runs clear. I'm going to throw this away. Now I'm going to go back. I'm going to take a piece of 4x4 gauze. I'm going to, before that, I'm going to take a piece of gauze, dry gauze. I'm going to make a little puff so I can dab this dry. Going from the dirtiest part to the cleanest part to the dirtiest part till it's dry. Now I'm going to take my 4x4 gauze, dip it in the solution. I'm going to wring it out and then unravel it. And then I'm going to take my piece of my Q-tips and once I have my Q-tips, I'm going to pack it in to the wound, making sure that I don't, making sure to pack it into all the tunneling areas and the undermining, making sure keep it sterile. Okay, and then I'm going to take a dry 4x4 gauze. I'm going to place it over the top, and then I'm going to take my ABD pad and then place it on top, and then I'm going to secure that with Montgomery straps. Okay, and now I'm going to dispose of all my products. And then I'm going to dispose of my gloves. Going to perform hand hygiene and assess them to a comfortable position. And I'm going to assess their pain once again. Can you rate your pain on a scale 1 to 10? Going to make sure the call light's up, the side rail is also raised. Make sure the call light's in reach. And then I'm going to lower the bed to the lowest position. And then I'm going to perform hand hygiene. I'm going to document the type and amount of irrigation used, the type and amount of dressings that I used, and then I'm going to document the reaction of the procedure, of the patient's reaction to the procedure, and then I would notify the physician right away if there is any brisk, bright red bleeding, any retention of irrigation, any dehiscence or evisceration, or any signs of shock.